Good evening, everybody. I'm your host for tonight, Mohammed Shahnawaz, President of Global Government Blockchain Association, UAE chapter. So, Government Blockchain Association is a technology agnostic center which is based in Virginia, USA. And our mission is to spread the adoption and accelerate the adoption of blockchain technologies through education, advocacy, and partnerships. We have over 50 chapters around the world, and the main reason of the local chapters is that we take the best use cases regionally and we spread through other chapters. So today's topic is about healthcare, blockchain in healthcare sector. And I'll start today's session with a real life story about a guy whose name was Mohammed Sadiq Khan. Sadiq Khan was a poor laborer in India, and he was trying to make his ends meet. So he was one day visited by a bunch of strangers who basically promised him a good job and an offer, and they asked him to go for an interview in a place. So he went there, and suddenly people kidnapped him and sedated him. He woke up, and once he gained consciousness, he basically saw a stranger with a surgical mask and gloves. He couldn't move his legs, and he had a pain on his tummy. So he asked the stranger, like, where was he? And the stranger basically nonchalantly replied that you don't have to worry, your kidney has been removed, we'll pay you for that, and don't tell anybody about this. This is a shocking true story that happened like 5 years ago in India. And every year, poor victims like Sadiq, their organs are taken out and sold in a black market. In the black market, there is basically every year, the organ theft and trafficking is rising every year. So what is the reason behind this? In 1991, who basically formulated something called guideline principles, which basically forbade the sale of organs, because the thing is unethical. And this is to prevent organ transplant tourism and to basically protect the vulnerable people like Sadiq. So, but unfortunately, every year there is a rise in demand of organs, and millions are there on the wait list, waiting for the transplant to happen. According to American Transplant Foundation, every 10 minutes, one new person is added to the wait list. Just in January of 2020, 114,000 people were waiting in just states alone. And this is resulting in deaths of 20 people every day in states alone, waiting for organ transplant. This is why many people from developed countries like States, Sweden, they go to developing countries like India, Pakistan, and get the organ transplant done, which is most of the case illegal. They pay, which is illegal, and this is giving rise to sale of organs in black market. Governments around the world are trying to find ways to tackle this problem, and one of the problems they found is making a registry where you go to a website and you pledge to donate your organs in case anything happens to you. Because there's one big fact is that one deceased organ can basically help 8 lives. Your heart, liver, kidneys can help give life to 8 new people, and your tissues can improve the lives of hundreds of people. Your skin, your heart valve, everything. So last year, Ministry of Health and Prevention, UAE, they made a registry where you go and sign a will to donate your organs if anything happens to you in an accident or anything, or any untimely death. And this registry was made by Dhonor Healthcare, which was started by the entrepreneur Wasim Marhabi. And one of the great features of this registry is the DNA matching. you have to match the DNA of the donor and recipient for any successful organ transplant. So this is one of the features, and this project was recently, along with the Minister of Health, it was recently shortlisted by World Economic Forum. And here, who doesn't know about blockchain? Anybody knows? Anybody here who don't know about blockchain? Please raise your hand. Because I already know blockchain, so I don't want to go with the definition. So the second project we worked on is Verofax, which basically verifies the authenticity of medicine and checks if the medicine is damaged or tampered. So these are the two projects he's going to talk about. So we'll have 24 minutes session where he's going to present his project. Then we'll have Q&A session. Then we'll open the floor to the questions. So let's give a warm welcome to Mr. Wasim.
So I guess let's show this slide. That's fine. Welcome everyone. So my name is Wasim Darabi, and I'm here in the company of my son, Ryan Darabi. We'll be telling about our journey, basically. How did we get into blockchain for healthcare and end up here, and where is that going to take us, basically, forward, and what do I identify as, added value within the healthcare for blockchain? Yeah. So healthcare is today faced with a number of major challenges. The major ones being with aging populations, with the cost of the healthcare is, as it is today, 15% of the GDP, and it's expected to reach about 20% of GDP within the next 5 to 6 years. These are trillions of dollars that are spent on healthcare, and government is already feeling the pain of that budget burden, and they're looking at innovative ways how they can deliver healthcare in a more cost-effective way, remotely, instead of having to go to the patient or bring the patient or having more face-to-face kind of interface, rather doing remotely and save a lot accordingly. There is a huge shortage of professionals around the globe, and if the time for the existing professionals can actually be more effectively managed by adopting technology, by allowing for that telehealth or eHealth, teleconsultation, all of those, that is the other major challenge that can be addressed. And safety and verification is the other major one, and that's where we really mostly are focused. Can anyone give a guess on what could be the major problems for safety in eHealth?
Patient data.
Sorry, yeah, medical records and privacy and all of that, correct? So that's one, that's very important.
Infections, maybe? Different
Infections or?
Yeah, infections, like transfer of viruses.
So basically, if you're quarantining people, you can still give them remote access. Yes, but in terms of major risks, think about it this way. How can you verify that the right doctor that is giving you an e-consultation is actually a doctor? How can you verify that the patient that is asking for pain medication or opioids is the real patient? With deep fakes today, you're able to replicate anything, How can you verify that this is the right individual, this IP? Because now you're talking IP to IP. So how can you verify that behind this IP is a real IP? And then that's the other. And then how do you verify that the product that is then the treatment product is correct? What if it is fake? What if it is, and so on and so forth. So this is where we're really focused. So within those three things, we're focused on the enabling technology for eHealth, specifically focused on safety and verification. Yeah. If you have any questions, just feel free to ask. So, what do? We've taken on a challenge basically to try and address certain technological enablers for eHealth to grow. So instead of looking at how we'll build the next e-pharmacy, how can you create an infrastructure for e-pharmacy so that everyone can get on board? How can you create an infrastructure for verifying that the medicine is the right treatment for the patient, and how can you verify that the patient himself biometrically, by country, different regulations, and so on and so forth. These are the kind of challenges that we've decided to take on board in order. For the organ donation, Ryan is going to talk about his journey, but basically we've taken on board, yes, provenance of the organ. How can we verify that this organ came from this patient, and what is the regulation to prevent a transplant unless you can actually find a way to check and match that this organ came from here and went there, therefore the transaction can be accepted, or it triggers an investigation. To achieve that, we have a team of talents actually. Some of them are based here, some of them are based in the UK, helping us with the development. And we've been actually blessed to be in this country and have the partnerships with the health authorities, which have helped us boost our business forward. Yeah. So overall, in terms of the roadmap for safe eHealth, there are three main funnels. There are three main buckets, if you may. That how do you access that eHealth? So how is going to eHealth transform the access to healthcare, to different healthcare services? How can you drive better value for the healthcare? And then finally, is there a way that you can prevent that, with different? And these are all different technological contributions that you can actually have. So under access, how do you optimize the experience for the patients and their, how you book the appointment, how easily, how can you, give a patient some content for him to self-diagnose somewhat, and then be able to know better which doctor to book. How do you ensure that the eligibility with the insurance and the payment for it is really optimized as a process? How do you ensure that an e-prescription is issued in a timely manner when somebody goes? Then you give the choice for the patients to go collect it from a certain pharmacy. On telemedicine and e-pharmacy, to make sure that all of those infrastructure, safety infrastructure are in place to enable the availability of an e-consultation or an e-pharmacy. On the improved outcomes, obviously, everyone is interested in that, but more specifically the insurance companies. The insurers are in the end paying, and they are charging their patients according to the outcome. So now you will see more and more a lot of focus on how can we actually better measure the outcome? How can we pay the providers of healthcare based on outcome? How can we link outcome to this? So it's more going to become, just like everything else, it's more like a service-based. So based on the results, you're actually able to receive your money. And this is for the doctors and hospitals and what have you. And then, go ahead.
This is the Verofax, right?
This is the overview of what we're working to disrupt, and then later on we tackle the two.
Oh,
yeah. So this is where we've identified actually the overall value. So areas that people can work on to disrupt in healthcare by creating digital alternatives, services in order to replace the physical kind of interaction. On patient experience, there's a lot of technologies coming up as well, Internet of Things and others related to the hospital automation also. So how can we quickly pass through, know where to go, which doctor you're going to see, what is the condition, and all of that. How do you streamline all of those? And then how do you give instant feedback rather than today, for example, it takes about 9 to 12 months for the feedback to reach FDA as well. You know, so some of the most advanced countries have a major delay when it comes to the timeline. And finally, in prevention, think about it as awareness. So how do you improve the patient's awareness on, or not necessarily patients, but general public awareness on what causes those conditions? You know, if we were all to exercise a little bit more, if we were all to eat a little bit healthier, if we were all to able to really work out that 24-hour cycle and give that recommendation to individuals on when they should, you know, be active, when they should eat what, and number of calories intake, outtake, you know. And then look at also on the authentication, like, you know, we're able to verify right doctor, right patient, right condition, or right quality of treatment, right quality of medicine. So that's basically where we see all of the different disruptions happening, and this is where we're focused. But we're focused mainly on a verification infrastructure underneath, which enables all of that to happen. So how do you verify all of, for each and every one of those points? Yeah? So our journey to date is we've set up the company in 2017. In 2018, September 2018, Ryan will talk more about that day. We were awarded the organ donation contract with the Ministry of Health. Since then, we engaged with the Department of Health in Abu Dhabi on the medicine, on the controlled medicine verified delivery. And in January of 2019, we launched the application for Hayat at the Arab Health. In July 2019, there was an announcement by the Department of Health that it has become mandatory for any medicine delivery to have certain checks to ensure that the patient that is receiving it is actually the one that is allowed to receive it. And then in January of this year, you know, there was another announcement on Hayat, the second phase, where Ryan will talk about it. And now, next month, we're planning to actually start the pilot in Abu Dhabi for controlled medicine delivery verification. So, you know, create that e-pharmacy marketplace where we connect all of the pharmacies. They're able to provide them the linkage to verify the e-prescription, the e-claim, to arrange for the delivery, and it's going in a safe box down to the patient, where the patient only can actually unlock that box and pick up the bag or the medicines inside. All right? All right, so over to Ryan.
Hello everyone, my name is Ryan. So I'm going to be talking about how I started Dhonor Health Tech and what problems were intended to solve and our general solution. So, okay, so the main inspiration for starting Dhonor Health Tech was when I saw this video right here. This is of a man who went to Disneyland every week with a shirt that says, "In need of a kidney, O positive," and call his number. And he had been laid off by his insurance. He had no way to, you know, connect with potential recipients, and he was at a dead end. And this was the only way that, you know, he could reach out to the community and see if there was anyone who could help him. And that sense of desperation really evoked an emotion in me that someone in this day and age of technology did not have a means to, you know, connect with any potential donors. And, you know, it's just you know, one person in hundreds of thousands of people yearly waiting for organs and in desperation. So once I saw that, I knew that I wanted to solve the problem and, you know, create a solution for people like this, people that desperate for organs. So I just took that idea forward, and, you know, I wanted to see where it went. So I presented the idea and sort of solution at an AI hackathon, and one of the judges happened to be the innovation officer at the health authority, and he really liked the idea. And we had further discussion from there. And he asked us, when we started to have discussions with the health authorities, they contracted us to develop ehealth, which was the National Organ Donor Registry. Can anyone just, before I go to that slide, can anyone give an estimate for the percentage of organs that originate from organ trafficking? Just some guesses. The percentage of organs that originate from.
It's 20%.
No, you've done your homework.
20%, sure, that's a fair estimate. Anyone else want to take a crack at it?
Is it not right? It's not right.
No, just
No.
let me get a guess.
I'll say 40%.
40%? Okay, so it's actually 10% of all organ transplants originate from organ trafficking. And these right here are the main problems that I wanted to
Is
see.
it here in UAE or?
No, it's all over the world.
All over the world.
All over the world.
Yeah, okay.
And these were the problems that I wanted to solve when thinking of the solutions, which was
Can I ask also a question actually before we jump into it?
right.
Can anyone guess what is the cost of an organ on average? Like if somebody is actually selling an organ, so why are they selling it?
It's for poverty.
Sorry?
For I mean, either they don't have money.
Yeah, but what is the cost? So,
They pay $1,000.
like $5,000. Huh? $5,000? It's actually $400,000 globally. Yeah. So, huh?
$400,000.
Yeah. So although that we say that there's no trading, but whenever there is trading, the average price is about. So some organs are sold for a million, north of $1 million, and on average, anything between 200,000 to
But this is the price between the trafficker and the buyer.
No, I mean, look, maybe it's, but that's not the point. I'm just saying that, this is what creates the trade,
Yeah.
right? The trade is that people when they become desperate, they have the money. They're willing to go to a certain extent just to, save their life. And then this becomes a problem that there's a trade. And the prices are increasing, and today is a couple of $100,000. So that's the whole point.
And that trade dynamic is not the worst of it. A substantial amount of these occur from people that are enslaved or abused for their organs. They're not even willingly going into it to begin with. And there are so many more issues with the industry. For example, 2 to 3% of the population will require an organ in their lifetimes, and we haven't been incorporating the newest technologies, at least in my opinion, the newest technologies to make this process more efficient. As we saw, a person, the main inspiration for this person, Disneyland, had no venues to connect with donors, and and we also want to raise awareness for the ways to prevent, because the best cure is obviously prevention to begin with. We want to raise awareness and work with academics to explain to people how they can prevent such things from happening to them in this region. So our main, when we were contracted to create ehealth, we took it as a goal to help the UAE set global standards and incorporate the newest technologies to make these systems more efficient. So in ehealth we launched phase 1 so far, phase 1 and 2, which were basically the National Organ Donor Registry, and we've had quite a few people sign up, and it's the National Organ Donor Registry where people can sign up, and it's a very quick process, very efficient. It's through an app, and they say if anything were if I were to die or if any tragedy were to befall, I pledge in my will that I am going to donate so-and-so organs. And we are hoping to launch phase 3, which consists, in the near future, which consists of DNA verification of organs and using blockchain technology to ensure transparency and secure provenance, as well as AI precision matching, which is matching the most suitable organ donors and recipients based on histocompatibility, based on DNA, based on history of diseases and illnesses.
In time.
And proximity, yeah. Proximity, time, all of those elements come to play, as well as teaming up with academics to raise awareness for the healthy lifestyles that people can incorporate to prevent such things from happening.
Sorry. I think I'll just add something to that. So here in this part of the world, everyone knows that the overall religion is Islam, right? The prevailing religion is Islam. Anyone knows whether organ donation is who thinks that actually the organ donation is illegal as per the Islamic regulations? Anyone from the team? You do? Yeah, you do? Okay. So I think the key thing also behind this is when we say awareness, is also cultural, heritage. So sometimes people think that this is the case, that although all of the Sharia experts from around the Islamic world have clearly said that no, the text of the book basically clearly says that if you save the life of one human being, it's like saving the lives of humanity. And there are so many other references in the hadith and so on and so forth. And accordingly, in that application, a lot of these misconceptions are also explained in the terms and conditions. So so it's in a way also awareness, because even if you try to have an opt-in or an opt-out system, that you will still clash with the family of the deceased, etc. If there is no awareness. And that's why they wanted the route of creating an easy plan where you have a smart contract where you can, see that it meets the minimum legal threshold, and it informs the family so that there's no contesting at the moment of, harvesting organs after that. Sorry.
Yeah, so that's also another priority of ours is to work with authorities and governments and just people in general in understanding how we can best fit the solution to their culture or to their needs, for example. And the way that we've adapted our solution to this region, the legislation and law here, is that Sharia law in general mentions that people cannot donate organs if it's a risk to their lives or when they're alive, when they might need it. But when they're deceased, is perfectly allowed for them to donate organs, and that's essentially what we do. Is that we haven't developed an organ donation system. We've developed a pledge to donate your organs if anything were to happen to you, and that's something that we take extra effort into when expanding into more markets, more countries and parts of the world. So I guess next is Verofax.
So one question, Hayat is now live, right?
Yes, so Hayat has been launched actually in January 2019 in the UAE as the UAE's official organ donor registry. January 2020, the national waitlist system that was put in place to connect all of the hospitals that are able to perform a transplant. That network is also now in place. And in that event, Ministry of Health, it's actually, you can look it up online, they've announced that now the same network is going to become a cross-GCC network for allocation of orders. So now we're going to actually link up all of the other ministries of health in the region to that same network for organ allocation, for precision allocation. What Ryan was saying is how do you using the global calculators like unos.org and other, All right, so moving on. So that was with the Ministry of Health. Moving on, we decided that we're going to build a platform for medicine delivery, the pharmaceutical marketplace with verified delivery. And that we got in touch with the Department of Health. They already had the program for buying pharmaceuticals in a safe way, and there was a reason also, a challenge there that we would be addressing. Who knows what does controlled medicine mean?
Yeah, yes. Nobody knows. Okay, control means only, it's not, it's not every pharmacy. It's very controlled, like.
Correct. But what does it mean really?
It's like you have to be careful to take it.
Patient has to be registered first.
correct.
Yeah.
Yeah, so yes, but more importantly, these are medicine typically that are pain medication, that are epileptic medication. These are medicine that can cause dependency, so people can become addicted to that medicine, and it can lead them down the rabbit hole of opioid, right? Opioid addiction. So it's quite serious medication. It requires, the very strict and overview. So think about it this way. Can you allow for sending controlled medicine in the mail?
Just give the prescription for a number of the days.
Yeah, so usually it's very limited, absolutely right. They calculate it even by pill sometimes, or if they're sending the pack, it is specifically for that number of days. So it's very restricted, you're right. But the question is, do you think you can allow for it to be sent by mail or delivery?
No.
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 What would be the criteria you think for allowing this to happen? To be able to send it to a patient?
Only the patient whose prescription can take it.
So how do you verify the patient? If only you're right, but how can you verify?
Pharmacy, in the pharmacy.
Some dispositives in the top of the bottle.
It's actually biometric verification, right? So yes, you're absolutely right. It is medicine that are controlled medicine is quite a serious medication. You require to make sure that only the designated recipient is receiving it, and therefore you require some kind, within the process of delivery, you require biometric verification. That's the critical thing. But then these people that are epileptic, they cannot drive. They cannot, so it's not like they have an alternative. They need to receive the medicines to their homes. And that's the other problem, because epileptic means at any point of time they can get into a fit, and if they are driving, it will cause accidents and many people to get hurt. So unfortunately, it is a catch that we are addressing. And when we went into this, we came to realize that actually a lot of the medicines that are available on the market are actually being dispensed. There's no regulation for delivery of medicine in many of the developing countries as well as the developed countries. Some are ahead of the curve, some are behind, but overall there's quite a bit of a lag between what the regulation should be and what it is today. So, and the problem is, in developing countries, there are certain countries that have 30% of the medicine is actually fake. So basically, people are living on placebo effect. I don't know how it's helping. In some countries where the government tried to create some track and trace, the pharmacists went and protested. So it tells you how much profit it's doing for all of these pharmacies. But this is an unfortunate thing because it's people who are paying for that with their money. So how to prevent it is the biggest problem. And 10% of overall e-pharmacy sales are actually fake products. These are not our statistics. This is what you can find online and verify. And this is a huge cost. Aside from the estimation is actually 200,000 people die from fake medicines and $75 billion lost to the economy, and so many people doing their riches based on those fake medicines. This is in a country in Africa, so there has been in Nigeria, in many countries, there has been raids where tons of fake medicine have been found. This is literally, I don't know if you can see, but this is an individual, walking on top of those mountains of fake medicines that were collected by the government. So just to show you the extent of it. In one country in Africa, it is over 44% the fake medicine. So, reactive measures have been taken. The EU have announced as of February 9, 2019, that every single medicine pack for controlled or prescribed medicine will have to have an anti-tamper tag, similar to what you usually find in your clothes when you buy them and you're going out and it rings basically. It rings an alarm. They've created one that has a tail that goes all around, so it locks it in the way when they are taping it or when they are gluing that box. For you to open it, you have to cut through a wire. The moment you cut through that wire, it will take you to an address. As a patient, you're able to verify, and it will take you to an address saying this medicine has been tampered. Don't use it. If it's not you who opened it, then don't use it. Yeah? So this is in the EU, and they have up until 2025 for all the countries, all 28 countries to implement that. I think already 6 have implemented, and there's another 22. In the USA, there's a project called done by MediLedger for blockchain for every single pill of medicine. So imagine every single pill of medicine now that will be given to the patient will be controlled by that blockchain, because in the US the market is more bulk filling. So you find those yellow tubes where the pharmacist is actually inserting the pills. So it's bulk filling at pharmacy. So MediLedger is already there. In China, the approach has been, if we find somebody that is selling fake drugs, we will find them, we will close that company. You might disagree or agree with, high tech, low tech, or everything in between, but basically everyone is on the same boat. Everyone is looking at how do we address this problem. And this is the system that we've created for this part of the world, the one that we're piloting starting at the next month. So it's an e-pharmacy infrastructure. What does it mean? Well, every time somebody goes to the doctor, an e-prescription will be issued to them. This is already standard practice in this part of the world, in the UAE. So automatically we have a listening, we listen to those e-prescriptions. We have the right to listen to it because we allow for the safe delivery. The moment that we receive a copy of that e-prescription, we ping all of the nearby pharmacies to ask them, do you have that inventory? The moment they confirm, yes, available, and we can make it ready in 30 minutes, 1 hour, 2 hours, then automatically we confirm to the patient, your medicine can be delivered to you as you requested within 1 hour or 2 hours to your location. He will store his location. We have from his eligibility or claim information, how much percentage he needs to pay, what percentage the insurance will cover. And then accordingly, we will allow him to pay on our platform, and we will ship to him the medicine via the companies that are delivery agent, that have delivery agent and listed on our platform. All right? This is our solution. It's quite simple, but it takes away all of those legalities, and each person is still accountable for the parts for the roles that they play. So we are not selling medicine. It is the actual pharmacy that is selling the medicine. We are not responsible for verifying the patient, but actually we require the ID and citizenship authority to give us the confirmation that the biometrics, if it is controlled medicine, that the biometrics of the patient, which is a fingerprint, this year it is expected to become a facial recognition thing from the phone application, that this individual is actually the right person that is allowed to receive in case of controlled medicine. All right? So what does that deliver for each stakeholder? For the pharmacy, they get the orders, they get safe delivery service, they get the capability via our platform as well to do chatting with the patient. Why is that important? Because this is a legal requirement. In UAE, if a pharmacist is giving a medicine to a patient, the patient has the right to ask for consultation, and the pharmacist has to give it. So we created as well a patient consultation, which is a chat basically, chat between patient and doctor. We know we have their IDs on both sides of the application. For insurance, what we do is we optimize their operation. So, you know, if somebody has received the fake medicine, yeah, would you be able to know if it looks exactly the same? No, right? And then if you consume that medicine and you didn't feel better, who is paying for that? Insurance, and partly is the person, and partly is the health of the individual, right? So these are the people who get affected. So by providing that verification infrastructure, you're actually, you know, helping the insurance to deliver a more effective service, and that's what we do. But also, sometimes, you know, in different countries, you find the pharma distribution companies that have pharmacies, they become too strong that they negotiate very hard and they keep increasing the prices of the medicine on the patients. When you have the insurance that have every pharmacy available within that e-pharmacy infrastructure, they're able to lower the cost of the medicine and lower the cost of the premium on the individuals living in a certain country. So, you know, this is how we're benefiting everyone. And obviously fraud prevention, which is, you know, to avoid any treatment that is not good to be paid for. All right? And for authorities, we've all been concerned if somebody sneezes next to us now. And I hope nobody will, thank God nobody's sneezing in this room. But yeah, so how do you actually manage strategic inventory on a country level? How do you, until today, you could find some discrepancies here and there. But if there are more integrated systems where every prescription is issued in inventory, where you have that connection of the inventory API, then you're able to better inform the governments, the authorities, on the shortages that are happening for certain strategic medicine or, you know, important medicines to have. You know, to prevent any flu in January or, you know, whatever is the hay fever in March and so on and so forth, right? And then obviously, faster feedback is an important thing for manufacturers, for the health authorities. If a certain medicine is all of a sudden, the patient has a voice and is able from within the app to say, okay, I'm getting allergy, I'm getting certain, I'm sneezing more or something. My heart is missing a beat. And then all of that feedback is being turned into real time. And this is something that the companies would be very interested in, but also health authorities, to try and say, okay, so, you know, there's a lot of doctors that are prescribing this medicine, but it's causing a lot of problems with the patient. So, you know, we have to investigate, we have to replace, we have to do this. This is the box that we have patented. So this is an IoT box, basically, that I don't know if the reading is quite clear. It gets locked by the pharmacy for controlled medicine delivery. Gets locked by the pharmacy, unlocked by the patient by scanning that QR code. It has a heat load calculator, so temperature sensor, and then, you know, it calculates if it reaches a certain heat load threshold. It has the fingerprint scanning panel and the NFC Emirates ID card reader. It has a GPS coordinator and a SIM card basically allowed into it. This is our patent. This is what we are able to use or let the pharmacies use to ensure that the medicine is not tampered with in the last mile of delivery. So from the pharmacy down to the patient, it's in a locked box. If it opens, we get notified. If the temperature reaches a certain, before it reaches a certain limit, we notify the delivery agent, and then we say, you know, just add an ice box next to it, put it in an insulated box, do something. Yeah? Any questions so far?
Yes, definitely it will give the security and safety and trust, but it will cost a lot for the medicine.
This will not add any cost to the medicine. Nothing. So it's a service, because the box is not disposable. It's one that we use again and again and again. So when, you know, the fact that it becomes a legal requirement, every pharmacy will by law is required to ensure the safe delivery of medicine down to the patient. they want to deliver, they have to do it in a safe way, in a verified way. Verified way means you have to have a safe environment. This is the safe environment.
Regularly they will take back the box and...
The delivery agent will take back the box to the nearest other pharmacy that might need the box. Correct.
So it's, it will be sanitized?
Reused, yeah. Yeah.
But who is paying for the service?
So, okay, so in our business model, per transaction, we charge the pharmacy.
Pharmacy is paying for the
Yes, and for the delivery, it's up to the patient or the insurance company or the pharmacy to decide. So, for example, if you have any delivery app today, you'll find certain restaurants will accept a zero charge for delivery. But somebody is paying for it. Who's paying? It could be the actual restaurant, it could be the delivery company, they have a big volume and they've given them a certain discount. It could be a combination of a number. And similarly, it could be the pharmacy, it could be the insurance, or it could be the patient. But, but what we do is we charge them per transaction. So we send them the order to fulfill a certain e-prescription, then we charge them per transaction, and we arrange for that delivery.
Who is actually putting the medicine in the box? Like
Pharmacist.
It's a production?
Pharmacist.
Pharmacist. So
He has an application as well to unlock and lock the box and place the medicines inside.
So the application will provide the security of the medicine only between the pharmacy and the patient.
Correct.
But what about if they put the...
There are other systems. So there is a global system for track and trace called GS1, if I understood correctly your question, which looks at the tracking the medicine in the right temperature from the manufacturer down to the pharmacy. And then we are providing the last mile of track, and we integrate to that. So we add whatever log is available to our log. Did I answer you?
Now, it looks a bit complicated. I understand. Suppose it was delivered from pharmacy and you gave somebody and he is outside and is trying. So in any case, in UAE, it's
50.
he is outside, and so I got the medicine, and because I was feeling sick, so I immediately after getting it, it's how it will a runtime calculation, or you will go back and you will monitor the temperature.
No, real time. It has SIM card. It has its own gateway. It has real time communication.
Real time only.
Yeah.
Otherwise, suppose I take the medicine and after 2 days I get to know that.
Let's say but that's the thing. So there's a number of engagements that we have with the patient through our application. So even after receiving the medicine, after 2 days you didn't feel good, or you're not improving your health, or you felt that actually your health is going down. You can report. You can literally look at that medicine and look in your history and say, okay, this medicine was prescribed to me under this e-prescription, but I'm not feeling good actually after taking it, after the full course or half course, or I'm getting certain condition, there's a red dots on my skin. I take a photo of the red dots, I can select the category, I can fill in what my feedback is on what I am feeling, and then send that in real time to the doctor. And that helps with the manufacturers to see what is happening to their medicine. That's where the added value is. The data behind that.
Okay, if suppose for a person like us, it's okay. But living here, if you find that the patient is a laborer or is a illiterate guy,
Yeah.
so it's not challenging for them to communicate and to send the feedback and something
Yeah.
like that.
I mean, actually we received the same challenge from the United Nations just last May 2019, which is how to make maybe the application more SMS and voice activated, to apply it in certain countries like some of the developing countries in Asia, Africa, and so on and so forth, South America. How can we actually make it more interactive using voice and SMS? And we're looking at that.
So one question I have is regarding the IoT.
Yeah.
The main thing in IoT is data, the amount of data.
Correct.
frequencies like per minute or per second? What's the frequency that is planned?
So for example, for a country, just to give you the overview, yeah? So for a country like, let's say UAE, you have a population of about 12 million. They visit the doctors once every 2 months on average. So, let's say 6 to 10 visits per year. And then when you look at the number of medicines that are being dispensed per order, you're talking about 2.2 medicine. So this is the overall universe. So when you ask me if we had 100% of the UAE, every single transaction we had to verify, what would it turn into per second? We've calculated that. But obviously, when you get all of that amount of data and communication and so on and so forth, you cannot put it on a blockchain. Because blockchain is limited to a number of transactions per second, and every transaction in real time is actually 8 minimum transactions on the blockchain. So it is because, it's not one transaction that this happened. It is this person has authorized that to happen. This person has used his public key to happen. Then, so it turns out to 8 transactions on the blockchain. And so when you multiply that by 8, and you get a much bigger number. And we've addressed this challenge by actually doing certain data that is done on a traditional setup, however, still managed by a blockchain engine. So the blockchain engine publishes on off-chain certain data, and then only publishes on the Hyperledger Fabric blockchain the data that is auditable or requires audit, or which pharmacy sent that medicine. That's one transaction. It is not 40 transactions that I need to report on the blockchain, if you see my point. So we limit the number that are on-chain transactions and off-chain transactions in order to ensure that with that volume of number of transactions, you're still able to manage to apply blockchain.
But that basically oversimplifies certain things, because out of the blockchain, certain data can be fudged.
No. So what you're saying is, let's say, today, an e-prescription was issued, right?
Yeah.
Rather than this person on the blockchain issued that this doctor issued to this ID, and therefore this was the number of the e-prescription, this is the platform that is used. Becomes a huge number of, all you're saying, then automatically the blockchain automatically will get a transaction. There's an e-prescription issued number this, so therefore it is stored somewhere else. Then all of these other transactions are stored elsewhere. So one thing is published automatically on the blockchain, on this permission blockchain, and then the rest is off-chain. If you see my point.
Okay.
But if you want more information, I can
go.
Right? Dan, any other question?
What is the average cost of that box?
Interesting. I need to ask you why, I need to know you, but then I can tell you.
I'm just thinking, if you maybe
hundreds of dollars, basically.
You remember there was a food theft in Zomato, it was happened in India. Few companies like you, they suggested the same thing even for the food delivery as well.
Yeah.
But the Zomato company, they rejected it because of the cost complexity. There are many factors. Because if you go back to the slide, you added many things. Many things. So
this is the battery, this is the charger, there's not many things. This is how it detects when it gets on, so it's like a gyroscope which is already available in a single IoT device. It turns on and off. There is no many things. It is 1, which is temperature, 2, which is GPS, 3, which is SIM card, 4, which is the biometric ID verification.
So what if the delivery guy accidentally fell down?
Insurance. We have ways to get that money back.
Insurance.
Yeah. But you're right. I remember the video where somebody was, eating from somebody else's food on the way. He parked on the side. He ate from other people's food, fixed it again, and then sent it for delivery.
The companies they suggest the same thing, but Zomato is acted simply because.
Yeah, but again, this is food, which, you know, I don't know how it's handled in different countries, and there the margin is smaller. And this is healthcare, it's people's health, and it's very regulated industry. It's not a choice. It is, you know, you have to have that controlled medication, you know, verified when you are delivering it. It's not an option. The only option is, do you do delivery or you don't do delivery? They want to do delivery, they issue the policy, they will ask for certain checks, which we enable.
Still you didn't answer my question.
I hope I did, but tell me if I did.
Average cost?
No, I told you in the hundreds.
Hundreds of dollars? Or
Yes, dollars.
So the other question is, you said you are not storing the complete log of the transactions in the blockchain, just taking the only Merkle root, I mean, just the root.
The auditable transactions, so for example.
But how you make sure that there is no tamper even if it is you are storing in the option, because
So
these transactions are evolution of time, because the first one transaction and the last transaction there is a time gap. So how can you make sure that there is no tamper in the middle transaction, because you are storing only the complete record of this, maybe the hash you are trying to store in the
That might actually be the right way to
Yeah.
advise.
So basically, today you have to decide, you know, because of the way that the blockchain works, you know, the transaction, you need to decide which are the important transactions that you will publish directly onto the blockchain. Which are the not so important. If the agent picked up the box from the medicine, if this agent picked up this box from the medicine, it's not, this box from this pharmacy, it's not going to be extremely important, but we still keep it, but in a separate off-chain record. The important one is, this is the e-prescription. It was delivered to this patient. All of the checks are done correctly. Biometric verification completed. So I minimize the number. If I want to have every single transaction, it will become 40 transactions, which there is no blockchain. Either you decide not to use blockchain altogether, because 40 transactions on the blockchain is going to be impossible for that one transaction.
So